So this is a, so basically if I need to write an order, I went to medical records, select a patient, go to features. And remember, in features, we can order supplies, we can write new orders, we can add notes, or we could do QI reporting, which is like they have a new antibiotic, we can add it. If they have a fall, we could do a fall report. So right now we're focusing on new orders. So if we get an order from the actual doctor that we need to, the doctor says, okay, I need you guys to do this wound care, then we want to send that order to the doctor and check verbal order and the day and time. And then we'd do wound care, yes. And then we put in our orders. And all my order formats is the same. Clinical finding, intervention, and goal. It's always the same. So if this was a verbal order for the doctor, clinical finding, pressure sore to left leg, lower leg, intervention, VORB, doctor, blah, blah, blah. Okay for wound care 3 times a week, clean with saline, cover with alginate, and use adhesive foam 3 times a week. I don't like to use Monday, Wednesday, and Fridays because that makes us get stuck to those days. I like to put 3 times a week or twice a week or whatever, not day specific. Goal, patient to receive wound care. So, and then we would add the calendar. And we go calendar, and they would add SN11s for Monday, Wednesday, Friday, and then buddy codes to, hey, you got to do wound care. AM, it doesn't really matter on the time. And then weekly measurements. So if we're not getting a verbal order, say we just want to add a PRN extra visit because a Foley catheter is leaking. So uncheck this because we're going to need to send it to the doctor. Clinical finding, patients Foley's blocked up. Intervention, 1 PRN skilled nurse visit for Foley care management. Goal, patient to receive Foley care. And then I would add the SN11 for today's date or whenever it applies. But don't send it to the doctor if we're not getting an actual verbal order. Or if we need to order supplies, make sure you have the doctor. Don't send to the doctor. Don't do verbal order. So say like, oh, I need some adhesive foam, but it's not on the list. Clinical finding, supplies needed. Intervention, skilled nurse to order supplies. Goal, patient to receive supplies. And then I would go to add supplies. And then I would add whatever is needed, like tape or whatever, and I'll select it. And I'll go back, and boom, it's in the system. Save it. And then I go back to the features, order supplies, and tape will be there. So otherwise, if tape's not there, I can't order it. So the same goes for add medications. If there's new medicine changes in the home, don't send it to the doctor, not verbal order. Clinical finding, new medicine in patient home, blah, 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 twice a day, 3 times, whatever. Intervention, skilled nurse to edit supply list. Goal, patient's med supply, patient's med profile to be up to date. And I'll go in here, and then I'll add whatever medicine's new in the home and just fill in the dose and the reason and everything. And then I would save it. And that's it. Then the med profile would be up to date. And that's done. So clinical finding. So I would use the same format to add medicines, add a PRN visit, add supplies. But if you get an actual order from the doctor, then yes, you want to check the boxes. If we want to edit the vital sign parameters, that has to be a verbal order from the doctor. So that would have to be checked, and we'd actually have to get an order. We can't change the parameters without an order. And that's how you write the orders. It's the same thing for everything. Just knowing when to send to the doctor, not to send to the doctor. And just remember, if it's a wound care and any orders, always select yes. Because if you don't select yes for wound care orders, this order won't carry over to the wound care ICC. So it won't link into the our wound documentation. So always select yes if it is wound care related. Even if it's just a dry dressing change or whatever.